Moshe, Elliot, thank you so much for the invitation to this wonderful meeting. I'm honored to be invited here, and I'm going to be talking about the efficacy, safety, and tolerability of 810 and 800 diode laser hair removal technology. These are interim results, bear that in mind. So my disclosures are that I have worked with a number of companies, I've been supported in my research, and I appreciate that association with all the wonderful engineers who have helped us to bring great technology to our patients. The study objective here was to look at the efficacy of two devices, two diode devices, and also the subject tolerance. How painful was it? How uncomfortable was it? With the Alma Soprano SHR mode using low fluence, high repetition rate, pulse stacking mode versus the Luminous Duet using a single pulse vacuum assist device. This was a split extremity comparative study looking at the axilla and the legs. I want to just preface my comments that for years I've been somewhat devoted to the Luminous device, the light shear, so I'm a little bit biased toward that. So when the Alma guys came to me to say, "Are you interested in this?" I said, I am interested, but the results are whatever the results are. And they said, "That's fine." So it's always a good way to start a study. I'm not the first person in the world to have compared the repetitive rate, the pulse stacking type. In fact, it was Rox Anderson who first taught me about 10 years ago the benefits of low fluence pulse stacking in the treatment of port wine stains with the pulse dye laser. And guess what? It works. It just takes a long time. So whether it was Marty Braun's study or Mario Tralez, my good friend Mario from Spain, who have come before me, I'm very interested in the concept of pulse stacking. So as you see in the slide before you, the Ruby, of course, was the first laser that was used for hair removal. It's still a very good laser. The reason they don't use it anymore is because above 3 or 4 milliseconds, the crystal becomes unstable. And so people have moved to the Alexandrite, and the diode now is very popular, whether it's the Luminous or the Alma or other systems, etc. But you can see at this wavelength, there's a good discrepancy between melanin and hemoglobin absorption. And you can see that 694, 755 gets a certain depth, 800 gets a bit deeper. Of course, 1064 is quite useful for hair removal in darker skin types, but of course is also quite painful. And as we realize, without going into it in detail, it's the anagen phase that we're particularly interested, where the hair still has some pigment, because that is your target chromophore. I shan't go into this either, but Christine Diericks has done some wonderful work in terms of follow-up studies with regard to telogen and anagen, the lengths thereof. So the two devices I'm comparing are the Soprano XL, using low fluence, 5 to 10 joules, high repetition rate at 10 hertz, pulse stacking with a gradual rise in follicular temperature. That's the key thing here. The epidermis is preserved, but the follicle, that's your target, is heated, which they claim good hair removal with less pain. This is the Soprano 810, two examples of which, and this is the device. Basically, it's what they call in motion, so you never keep it in one place. Woo, that was fun. It's constantly in motion, and as such, you come back and pulse it a bunch of times. Versus the light shear, single pulse, it depends on tolerance, for 6 to 12 joules, something in that order. A large 22 by 35 diode array, vacuum-assisted technology, which again reduces discomfort and less energy is required in comparison to the traditional light shear device, and increases the efficiency. Both very good devices. Here the light shear, here's the suction unit, which I say is a very novel device. It sucks the skin up toward the diodes, and then you place it in position, and then you flash it. after the skin is very close to the diodes. So the study design, 20 subjects, randomized, IRB-approved study, axillae and/or lower legs bilaterally, one tried side treated with a Soprano, other by the light shear, 5 laser treatments, approximately 6 to 8 weeks apart, and 3 follow-up visits, 1 month, 6 months, and 12 months. So we're at about 5 months now post-treatment, and we do questionnaires and follow-up photographs and so forth. We had, in terms of skin types, no type 1, type 4, type 2 through 5, had 2 patients with darker skin types there. So we got 20 subjects currently enrolled. 18 of the 20 have completed at least treatment 4. 11 subjects have had their follow-up, 1-month follow-up visit after 5 treatments. We had no unexpected adverse events and no serious adverse events, but we did have some mild burns, as you'd expect occasionally from these devices. No blistering, all have resolved. So this is with a Soprano, the axillae before. You can see magnification. Again, this is after 5 treatments and at high magnification. And I would say very similar results. This is the duet before and after. These are, as I say, on the axilla. Nice results. And on the lower leg region, again, before and after with the Soprano, and before and after with a duet. And I think you'd see, sitting down there at the back of the auditorium, that it looks kind of similar. And guess what? It is. The results in terms of efficacy was very similar. I think the difference here was the subjective pain assessment. In the yellow is the average pain scale with the duet. That's the luminous device. And in the white is the average pain with the Soprano. And I would tell you that there was a significant decrease in pain level. Our patients pretty much all said that the Soprano was less uncomfortable. You know, as I say, I was a bit biased beforehand, but I've been impressed that multi-pulsing, stacking, does actually work. And as such, I think we should take note of this, not just for hair removal, but for, as I say, for port wine stains and other conditions. It's like Tom Rohrer has shown us with telangiectasia, with the pulse laser. If you multi-stack those, they can go away with 4 or 5 pulses, something we couldn't do without cryogen refrigerant. So in summary, interim results show effective hair removal with both modalities. The subjects report somewhat less pain with the Soprano in the super hair removal mode. And obviously, we still have 1-year follow-up data pending, but it's likely that these results are going to stand. With that, I'd like to thank you so much, Moshe and Elliot. Thank you. Bye-bye.